Andrew. Thanks for writing in. Yeah, Syringomyelia is a pretty distressing condition that is most commonly seen in the Cavalier King Charles Spaniel. And that's largely to do with the shape of their skull relative to the opening to their spinal cord. And that leads to the accumulation of fluid pockets called syrinxes along the spinal cord. And depending on how many or where the location of those syrinxes are, that will dictate the severity and the type of symptoms that we tend to see with this condition. Some dogs might show really mild symptoms like sort of scratching at the head or neck, which is referred to as phantom scratching, and often is mistaken for chronic ear issues. While others can show signs of discomfort or pain when in certain positions or when moving around, getting up, lying down, and this might present with crying or yelping, or it may just present with a reluctance to move in certain ways. So it's not always super obvious that that's exactly what's going on. Weakness, paralysis, ataxia, which is sort of a wobbly gait, and seizures are also possible, depending again on where the syrinxes are and how severe they are. Ordinarily, I would expect signs of syringomyelia to appear earlier in life, usually between the ages of sort of 6 months to 3 years. But particularly milder cases might take longer to appear. So it wouldn't be unheard of to have this condition start to show up, in a 7-year-old dog. The trouble is that the signs of syringomyelia can mimic lots of other conditions, including injury, arthritis, nerve inflammation, tumours, or meningitis. So a physical examination is a must. Diagnosing syringomyelia involves an MRI, and treatment is ultimately down to how severe the case is, and also the circumstances of the patient and the owner. Surgery is often needed in really severe cases, whereas milder forms are often managed with medication alone. In Zoe's case, her clinical signs might initially come and go, but if it is syringomyelia, then I would expect those signs to persist or even get worse over time. So ultimately, I would urge you to book an appointment to have a physical examination with your vet, and that way you can decide on a plan from there. If you do want to talk about Zoe's case in a little bit more detail from home, you can book an online appointment with a vet at pangovet.com. And I've also included some links at the bottom here that could be of use for a little bit of further reading. All the best.